My name is Trude Carlsen and I'm a PhD candidate at the Cardiac Exercise Research Group led by Professor Ulrik Wisløff at the Norwegian University of Science and Technology. I'm here to talk about our article, Long-Term Changes in Depressive Symptoms and Estimated Cardiorespiratory Fitness and Risk of All-Cause Mortality, the HUNT study. The take-home message from our study that staying fit and having low levels of depressive symptoms over time seems to improve long-term survival substantially. Clinicians should assess both depressive symptoms and estimate fitness on a regular basis and implement strategies to improve both when needed. We estimated fitness levels and obtained self-reported information on depressive symptoms from more than 15,000 middle-aged and older Norwegian women and men. All of them attended both the second wave of the Nord-Trøndelag health study in the middle of the 1990s and the third wave 11 years later. We followed them for 7 years after the third wave to see how changes in depressive symptoms and fitness over time were associated with long-term survival. To estimate fitness, we used the fitness calculator, a non-exercise model developed and validated by our research group. The model has previously been associated with all-cause and cardiovascular mortality and can easily be implemented to estimate fitness in clinical practice. What we found was that those who reported persistently low levels of depressive symptoms and had high estimated fitness had almost half the risk of dying during follow-up compared to those with persistently low fitness and high levels of depressive symptoms. We also found a similar risk reduction in those who had persistently high fitness and reduced their levels of depressive symptoms between the two surveys. More than 350 million people worldwide are depressed, and people with depression face a higher risk of cardiovascular diseases, hypertension, and type 2 diabetes. In our study, both long-term depressive symptoms and low estimated fitness were independently associated with increased risk of all-cause mortality. On the other hand, high estimated fitness over time was not associated with significantly reduced mortality risk in those who scored high on depressive symptoms in both surveys. The latter finding shows the strong detrimental effect long-term depressive symptoms might impose on health. It also indicates that the association between long-term depressive symptoms and all-cause mortality works through different pathways than the cardiovascular system. In conclusion, middle-aged to older adults with low fitness and a high degree of depressive symptoms are at increased risk of early death. We need to implement strategies that can reduce long-term depressive symptoms and increase fitness, as improvements in both are associated with considerably reduced long-term mortality. Finally, yet importantly, I would like to thank my co-authors from Norway and the US for great collaboration with plenty of fruitful discussions and input, making this into a great paper.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.